BJC is the first company in the St. Louis area to take on this challenge and to form an accountable care organization to try to bring doctors together to take better care of seniors. Seniors are really going to enjoy the experience of being in an accountable care organization. The quality of the care that they get is going to go up. There's a big emphasis on getting doctors to talk to each other, on a care plan that is formed once a year that is transparent, that everybody who's involved with the care of that patient can see and they can operate from, which means less unnecessary testing, less mistakes, fewer times that physicians may write a medication or something that conflicts with something another doctor is doing, and the ability to communicate with their physicians in a way that is much easier than it has been in the past. Patients are going to enjoy the fact that everywhere they go, whether it's to a doctor's office, through a rehabilitation center, even if they're in the hospital, that everybody involved with their care knows what's going on and knows what the other physicians and other people who've been involved in their care are doing. Patients under the accountable care organization can go anywhere they want to. They can choose any specialist or primary care that they would like. They're going to get the best care when they have care inside a system where it's easy for doctors to communicate with each other and easy for test results to be seen by everybody involved in their care. But that being said, Medicare recipients are free to choose the doctors that they feel best will serve them and where they get the best care. Patient caregivers are really going to like this a lot, because if you're trying to help your mom or dad out and ensure that they get decent health care and that they're kept well, you're going to be reached out to in a way that you haven't been before from a doctor's office. And you're going to understand what's happening with your mom and dad much more clearly, and that lets you be more effective in helping them. So I think people are going to enjoy it a lot. Physicians are going to like the experience under accountable care. Most physicians go into practice with the idea that they really want to take great care of patients, and accountable care is going to help them to do that. So if I know that a diagnosis has just been made on a patient of mine at another facility who I don't normally use, but I know that they're about to use medications or the patient's about to undergo a procedure that's going to conflict, say, with a medicine that I've given them, then that lets me pick up the phone and make sure that we head off any potential conflict and complication, because if the other facility doesn't realize perhaps that I've given them a medicine that's going to conflict with what they do. So there are many ways that having that information can give real-time care benefits to the individual involved. What BJC Accountable Care is going to focus on is having the information come to us strictly from Medicare in a safe and confidential way. We're going to treat that information carefully and use it only so that we can improve people's individual care. We want to know what's happening with a patient, everything that's happening with them, so that we can understand how we can best serve them, and that's our goal. But patient privacy and the confidentiality of personal information is of utmost importance to BJC, and so people need to understand that we take that very seriously, and your personal information will always be protected with us. There's several ways that people can get great answers to their questions. The first is by visiting our website, which is www.bjcaco.org. And there people will find information posted about what an ACO is, how we operate, what it means to their loved one to be in an ACO, and they'll find other helpful tips about how to stay healthy and well for seniors. And I think people will find that very useful. Another way is to call Medicare. It's at 1-800-MEDICARE, and Medicare is prepared with folks who are there to answer their questions, anything they have to ask about an ACO, and even ask about our ACO. They can ask how we're doing and get answers to their questions to make sure that they're comfortable with being part of this process. I think when people do that, though, they're really going to like what they see. They're going to realize the improvements in quality and realize that their loved ones are going to get better care.